Set, go.
Hello, my name is Ayan Puri. I'm a HOSA State Representative. I'd like to thank you for taking your time to speak with us here today. I'd love for you to introduce yourself and give us a bit of your background in the healthcare sector and where you are right now.
Okay. My name is Les Lacy. I work with Great Plains Health Alliance. I'm a vice president for regional operations with them. We manage and lease hospitals across the state and into Nebraska. I've been a registered nurse since 1982. I've worked in every department in the hospital since 1977. The only department I haven't worked in is IT because they didn't have it back then, frankly. So.
Yeah. Awesome. So now just looking back from, like, you said you started in the healthcare sector in 1977 to now we're in 2023. So can you just kind of outline what key differences you've seen, what's stayed pretty similar, just kind of comparing and contrasting then versus now?
You know, as I think about it, the economic environment has changed quite a bit. When I started in 1977, I was an EMT and didn't really know very much about the hospital business itself. Later I worked in the lab and x-ray, and again, I didn't know very much about the hospital business itself. And our focus was chiefly what was best for the patients. And that one focus really hasn't changed. Mm-hmm. You know, I think the changes have been in the law and the reimbursement and the economic environment. In addition, some of the laws have tightened up so that it takes certifications to do things that we learned on the job back in the day.
Yeah, awesome. And kind of talking about your career progression, right? So obviously from being an EMT, you've come a pretty long way to now being the vice president of regional at Great Plains Health Alliance. Could you just kind of outline how that process, how that journey was, what key steps you had to grow to such a great position to now being in a leadership role? I just love it if you could outline key steps or key advice that you could offer for going up those ranks at the hospital.
I think one of the primary things to remember is I would remind you of some of probably the links that you see, the little YouTube videos or Facebooks. They talk about the 10 things that make a great employee. I think if you embody those, then that will help carry you forward. Mm-hmm. And so while I started off as an EMT, I also helped cutting the grass. I've replaced filters in the system. I've done a little plumbing in the hospital, believe it or not. I can run a floor, I run a mean floor buffer, different things like that. A little hospital that we had wound up with people sick, and so you'd wind up going into the laundry and doing laundry, helping fold laundry, even cooking sometimes, although I'm told I'm not a great cook, which is fine with me. Washing dishes, you do what's needs to be done. And so when I talk about that employee thing, understanding what the company needs and then doing it, and understanding what the company's goals are, and then keeping that in mind as you choose different things to do and choose your actions, I think that's a key element. I think it's really important not to put yourself above anything. Dive in, do what you can, where you can, with what you know, the best way you can, safely, always safely. And so I've been blessed with a lot of good people that tell me, well, do this, do that. Don't do that, don't go in there, different things like that, and then follow their instructions completely.
Yeah, kind of going off that last point, could you just kind of talk about the role that mentoring and networking has had in that growth? I'm sure in the healthcare sector it's immensely large, so I just kind of like to hear maybe some specific examples or just your overall experience with mentoring and networking.
I had a mentor early in my career. I've had a couple of very good mentors. And one was Clarence Burson, and I know he's passed away now. He was a pharmacist and he was a hospital administrator. And he would come in and he'd say, well, that's really good. This is how you do that. Here's a book to learn this with. And then he would kind of correct me or tell me what I had done right, and so that was always good. And then the other one that I think has really shaped my career was a director of nurses from Springfield, and her name was Dottie Woodhouse. And I don't know where she is right now, but when she would leave you a note, she'd have a little smiley face with dots. draw a smiley face. It's like the early emojis were done with pens and pencils, right?
Yeah, yeah.
And so she was doing an emoji like that, and so she had such a sweet way of telling you things or directing you to do things, and she would always ask, what do you think is best for the patient? How can we do this in a way that will honor them, that they'll be pleased with? How can you do this in a way that their family will be happy with? How can you do something in a way that will help them maintain their dignity and all that? And so, you know, there's some things that you do around patients and some things you don't do around patients. And actually, those things you don't do around patients likely shouldn't be done anywhere.
Yeah, 100%. I just kind of like now to hear about where do you think the future of medicine lies from a technological perspective. You mentioned that, you know, this mission of patient-centered care has always been at the forefront of medicine, but really it's the technology, the laws that have changed. So, you know, you've been very experienced in healthcare. I'd love to hear your thoughts about where the future of technology, AI integration in the next 10, 15, 20, 50, 100 years. I'd love to hear your thoughts about where do you think that future of medicine lies?
You know, as I look at it and you talk about AI, I'm excited about the advent of AI, although I don't know where it's going to take us. I think it has a number of hazards, and I think those need to be mitigated and handled very carefully to make sure that we maintain the best thing for patients. I think it has some cost savings opportunities. In the end, though, it's going to boil down to somebody with their hands on a patient, and because that's where the rubber meets the road, doing the best thing for the patient. I don't think we can escape. I don't think we would want to escape or get away from the human interaction that we have between a caregiver and a patient. So I think that's going to be a constant that always goes through. And when I talk about caregivers, you know, it goes from the maintenance man that goes in and fixes the faucet in the patient's room to the environmental services worker who cleans the floor and visits a little bit, to the person that prepares the meal, and a lot of times nowadays they deliver the meal and they'll deliver a warm cloth to freshen up with, you know, and it goes on to the everybody that touches a patient, lab, x-ray, imaging, the providers, all of that. So that's all important. But in addition, the business aspect of it is going to get, I think, more challenging, you know, as we try and do more and more with fewer resources and more highly regulated resources.
Yeah. And what do you think the implications of, you know, either AI, telemedicine? You work a lot with rural health. So what do you think the implications of those technologies, specifically with rural health, is? Because obviously there's a pretty big disparity right now with rural and urban health. So how do you think we can leverage this technology to help supplement and help grow the rural sectors of healthcare?
When we look at rural, in Kansas at least, we're talking about frontier. Many of the counties are frontier in nature by federal definition, fewer than 6 people per square mile. And when you have population density that is that low, it's very difficult to support some of the specialty services at a level they need to be, you know, they need to have volume in order to survive. And if you don't have that volume, well, think about it. They've got to travel from wherever they live to that remote rural setting, so they've got the windshield time there. They see a few patients and then they have to travel back. And so something that overcomes that, like telemedicine, I think can be one of those things that helps overcome the challenge of geography, the geography challenge that we have as small rural communities. I don't think it's done as well as it might be done yet. I think it's really improved over the last 20 years. I was a part of High Plains Rural Health Network in the late 90s, you know, and we were starting to do things, but even then, you know, our telemedicine rig costs $70,000 now, and you can do it with a phone now, for crying out loud. So things are changing so rapidly. The other thing I think that's going to be an issue is security. Security is going to be a big deal. I mean, we have, for this lack of a better term, I'm going to say bad guys who try and steal our information and then steal money from folks, and sometimes they wind up injuring people because they may decrease the access to the electronic medical record or what have you. And so I think the security is going to be one of the things that goes with that. And so we're gonna have security, we're gonna have the newer technology, and how do we interface? What kinds of things can we do to tie those special things from the body to your phone? And I know there are electronics that do the, EKG and do the temperature and do all those things, and we have those things. But I think making them easier to use for an old guy like me, or my mom, who's 86 years old right now, might be a good thing to help us advance down that trail.
100%. And I think with this, the growth of technology, there's obviously a lot of room for improvement. I would love to hear your thoughts about, where do you think that improvement lies? Do you think it's the public sector, the private sector? And with that, where do you think there's other room for growth in medicine? What do you think are the barriers in the status quo for entry into healthcare? And how do you think we kind of help remedy a lot of those problems? What's the solution to that?
Actually, as you talk about remedying the problems behind healthcare, I think one of the huge problems we have right now is workforce. And so my being here, visiting with you, my activity with the Health Occupation Society of America is actually related to that. And I think the best thing is to make sure people know that there is a wide open opportunity, and it goes completely across the gamut, from someone who can be trained on the job to someone who needs 10 or 12 years of training to be able to do their job. There's the whole gamut of possibilities there. And as I think through that, I think that is probably the key element on all of that. As I continue to kind of wax on along that line, I'm thinking that it's important to get young people engaged and to get past some of the gender issues. I'm a registered nurse, okay, and I have been since 1982, but I think only 11% of the nurses in the nation are males. And I'm thinking, wow, what an opportunity. Those guys are sure missing something, My son works outside in the wind and the cold and everything else. I work indoors. And so, I like to think I make a pretty good living doing this, and I have had a world of opportunities opened up to me. I was talking with my wife just the other day, and it determined that I've been out of work a total of 1 day since I got into healthcare.
Wow.
And so I actually had applied to nursing school, working in healthcare. I applied to nursing school, and then I left my job on a Thursday. We moved on a Friday. I went on that same Friday to the local hospital in Garden City and applied for a job, and I went to work the following Monday.
Wow.
That's the longest time in the last 43 years that I've been out of work.
Very impressive.
Well, it's what it is it's an opportunity that's available to everybody. And so I applaud HOSA for pushing that forward.
Yeah, so as we kind of conclude here, I'd love to hear some final thoughts you have for the future health professionals of America and beyond. If you have any tips, any thoughts you'd like to share, that'd be very, very appreciated.
I think being a good employee, doing all of those things we talked about, you can search those. Somebody's got the top 10 attributes, the top 12, whatever they are. They're all pretty much the same, I think learn those, follow those, be a good person, and then saddle up and do it. Saddle up and do it, and don't give up. You have to be a bit tenacious. Some things are harder than others, but if you hang on and go through, the patients are having some hard times too. So that's what I would say.
Awesome. Well, I really appreciate your time. Thank you so much for sharing your insight, your thoughts, and your experience. It'll go very far, so I really appreciate that. Thank you.
Thank you very much.
Awesome.
Thank you.